Good afternoon. Thank you for staying with us until now. My name is Abuhasira. I'm from Ben Gurion University of the Negev, graduated from medical school there last year, and currently doing my PhD in the Cannabis Clinical Research Institute, focusing on medical cannabis in the elderly population. And today I'm going to talk about data that we gathered from two large registries of elderly patients treated with medical cannabis in Israel. Okay. So one slide before the registries is why should we talk about the elderly population in separate from other adults? What are the special considerations? So we know that in the elderly there are changes in their pharmacokinetics and pharmacodynamics. There is a decrease in their lean body mass and rise in their body fat, which is very important for cannabis, which are small lipophilic molecules that accumulate in fatty tissues. We know also that there is a decrease in their both hepatic metabolism and renal elimination mechanisms. We know that there is an increasing amount of comorbidities and polypharmacy in the elderly population. They use a lot of medications. We know very little about the interactions of cannabis and all the other medications we prescribe to the elderly. And of course, their decreased functional and cognitive status. We know that the elderly are more susceptible to central nervous system adverse events, which are the most common adverse events that we see in cannabis in general. And we don't want to harm our patients when we give them cannabis. That is the most important thing at first. So after saying that, let's talk about the two registries that I want to present today. The first one is a registry that we did in collaboration with Tikkun Olam. It was published earlier this year in the European Journal of Internal Medicine, so you can read further over there. So the design, there was a prospective observational study of all patients above 65 years of age who received their medical cannabis from the company Tikkun Olam, which is the largest cannabis producer in Israel, for those who don't know. The treatment initiation dates were from January 2015 to October last year. The patients were interviewed at treatment initiation after 1 month and after 6 months of treatment. Overall, 2,736 patients initiated treatment during that time period. About 20% of them died within 6 months. Another 25% were treated for less than 6 months when we decided to end the follow-up. So almost 1,200 patients were eligible to answer our follow-up questionnaires after 6 months of treatment, and of them, 75%, 900, responded. So for the demographic characteristics, we can see that almost 50% of them were above 75 years of age, pretty much half male and female, and most of them used either oil and inflorescence, and number of regularly used medications, a median number of 6. As I said, polypharmacy is a big issue in the elderly. Regarding the indications for cannabis, more than 90% of the cohort received cannabis either for cancer or for pain, or for cancer-associated pain. So these are definitely the largest and most important indications. I should remind you that these indications are subjected to our Israeli regulations. As was said on this stage here before, there is a specific list of indications for which we can prescribe cannabis to patients in Israel. So definitely cancer and pain are the most frequent ones in the elderly. Here you can see that we evaluated the pain intensity before treatment and 6 months after. Before the treatment, you can see on a scale of 0 to 10, we had a median pain level of 8, which was reduced to a median pain level of 4 after treatment, which was very significant both statistically and clinically. We asked the patients to evaluate their quality of life on a scale of very bad to very good. And again, almost 2/3 evaluated their quality of life as very bad before the treatment, in comparison to almost 60% evaluating their quality of life as good or very good afterwards. We asked the patients to assess the general effect of cannabis on their condition, and as you can see, most of the patients reported either moderate or significant improvement, with a negligible number of patients who reported deterioration. Regarding adverse events, a third of the patients reported experiencing any adverse event due to cannabis, and 38 patients decided to stop the treatment due to those events. None of the events was very frequent. The highest frequency adverse event was dizziness, followed by dry mouth, somnolence, weakness, and so on. Most of the adverse events were mild or moderate. Here you can see a long table regarding the changes in the drug regimens. I will not go over everything. I just want to emphasize what is in the red square, which is the opioids and the other analgesic drugs, that you can see that a significant amount of patients either stopped or reduced their opioids or other analgesics after using cannabis, which is a very important issue. Now I want to switch to a new registry that we are still currently holding, a registry that is done in a collaboration with a Neomedic Geriatric Clinic, which we'll see also further on. This registry began in January 2017, and today I'm presenting data until April this year, but we're still in the part of collecting the data, and we're going to enlarge this registry much further. The reason we decided to do this collaboration is because we wanted to focus more on the needs and the characteristics that are specific for the elderly, which some of them weren't in the first registry that I showed. So the inclusion criteria were men and women above 65 years of age that received a license from the Israel Ministry of Health, and no exclusion criteria. It's an all-comer study. We want to make it as real-world as we can. So again, a prospective observational registry study. Again, data collection at 2 time points, at baseline before the treatment and 6 months after, with a thorough geriatric evaluation that we do at baseline. Here you can see the current number is much smaller, 104 patients, but it is still ongoing, and by the time we finish creating the registry, I hope it will be also a very large one. You can see here that more than 80% were above 65 years of age, 60% female, and you can see that the MoCA score, MoCA is the Montreal Cognitive Assessment Score, which is used to assess the cognitive status. It is a score between 0 to 30, where between 18 to 26 is mild cognitive impairment, and above 26 is normal. So you can see that the mean score was within the range of mild cognitive impairment. The indications here, pain is by far the most common indication. The reason that malignancy is a very small indication here as opposed to the previous registry is because most oncologic patients receive their treatment, their cannabis treatment in the hospitals in Israel, and here we're dealing with a private clinic. Regarding the characteristics of cannabis use, so we can see that most people use between 20 to 30 grams of cannabis per month. The preferred route of administration is oil, and most patients use cannabis 2 to 3 times a day. And you can see that only 3% of the patients, a very small number, had a previous experience with cannabis before reaching the clinic. We asked the patients about their appetite. Half of them did not feel any change in their appetite, and approximately 40% reported either a small or a significant increase in their appetite after using cannabis, and 40% of them reported the change throughout the day, and 18% only immediately after consuming cannabis. We evaluated them with the GDS, which is the Geriatric Depression Scale. It is a score between 0 to 15, where a score above 5 says that we have to evaluate further for depression in that patient. So you can see that the median score before treatment was 6, afterwards it was 5, no difference. In IADL, which is Instrumental Activities of Daily Life score, here between 9 to 27, where 27 is the best functional status and 9 is the worst functional status. So before treatment, the median IADL score was 29, afterwards 18, not a significant difference. But as you can see, the numbers are still small. We're still collecting that data, and we will see how it will change or remain the same in the future. Again, regarding drugs, so you can see also here the opioids and the other analgesics, which were significantly reduced in this cohort after using cannabis. Adverse events, similar to what I showed before, 40% report adverse events. Again, dizziness, soreness, dry mouth are the most common. Will not repeat it. So the strength of the studies, they showed real-world patient data. They comprise very large populations. The registry of Tikkun Olam is very, very large, and the registry of Neomedic will hopefully increase. And something that is important to emphasize when we speak globally, in Israel we speak only about approved medical cannabis patients. We see many articles from around the world that speak about patients who are self-medicating themselves with cannabis, and things like that. And here in Israel, because of our regulation, we speak only about patients who are evaluated by physicians and approved by the Ministry of Health to get their cannabis. The limitations, these are of course observational studies with a significant potential of a placebo effect. We had a pretty significant loss to follow-up in the Tikkun Olam registry. And of course, most outcomes rely on self-reported data. Even when we use valid questionnaires, it's still something that the patients say that we cannot assess objectively. So in conclusion, we can say that the older population is a large and growing part of medical cannabis users, but we don't have still enough evidence for the safety and the efficacy of its use. Cancer and pain are the most common indications for prescribing medical cannabis in Israel. We can see that cannabis is effective in both reducing pain and improving general well-being. And the frequency of adverse events due to cannabis is low and is not higher in the older populations compared to younger adults. Thank you very much. I would like to thank all of my collaborators and my supervisor, Professor Victor Novak. And that's it.